My name is Mike McKnight, and I am a member of the State Bar of South Dakota Lawyers Assistance Committee. Well, lawyers assistance is really important right now, I think, and particularly in this day and age. The law has become a very stressful profession, and I think there's a lot of lawyers out there that are suffering from substance abuse, mental health issues that just simply, like me, didn't know where to turn or what to do, and I think lawyers assistance is very important to our bar. I started to recognize it, I guess, and it started to sink in with me because I was becoming increasingly frustrated. And the more angry I got and the more frustrated I got, I think the more that led me to believe that there was something wrong. It had not been that way for the prior 20 years of my practice. And it just took me a while. I can remember as clear as 5 minutes ago the day that I finally decided I was going to go, and I finally made that decision on my own. And I literally broke down at my desk. I could not take it anymore. And I made the phone call and got in, and I was scared to death to go. I didn't know what they were going to do. I had no idea. But it was really nothing to be afraid of, and like I said, it was great. I wish I'd have done it a lot sooner. My goal and my hope is to get people to recognize when they're having problems, and there is nothing to be ashamed of, and by all means, go get treatment. Together, we hope to make our profession thrive, improve the lives of those around us, and live above the bar.
Hello, my name is Pamela Ryder, and I am president of the State Bar of South Dakota. And joining me today is Dr. Singh from Sanford Psychiatry. Welcome to our State Bar's Lawyers Assistance Committee's Living Above the Bar series, where we will discuss a variety of health-related topics that impact us both personally and professionally. Today, Dr. Singh and I will discuss how to identify and know if you need help with an anxiety-related disorder. But first, Dr. Singh, thank you for joining us today.
Thank you.
As I mentioned, this video series will focus on anxiety, how to recognize it and take care of yourself or someone you care for when anxiety strikes. It's important to mention that anxiety disorders are one of the most common disorders diagnosed in the United States. Nearly 40 million people, adults, are affected by this disorder. That's about 18% of our country's adult population. Dr. Singh, would you explain to us what is anxiety?
Anxiety is a condition where individuals have difficulty slowing their perception of stress. So what ends up happening is that these individuals are in a constant state of stress, and their body is in a constant state of stress. So it's very difficult for an individual to be able to relax when they are not in a situation that is not necessarily stressful. Now, anxiety to some degree is normal. It's a normal phenomena that the human body reacts to. So to some degree, all of us will have some level of anxiety. If you have a big case coming up, if a big event is coming up, you will have some anxiety. And in fact, to some degree, anxiety enhances our ability to handle stress. But if you are in a constant state of anxiety for a prolonged period of time, that is when it starts to affect not only your mental health, but also your physical health, and your ability to function gradually will start to diminish.
Okay. Dr. Singh, would you please discuss with us some of the causes of anxiety?
So the most important cause of anxiety is genetics. So genetics play a very, very important role when it comes to anxiety disorders. So when you look at individuals who have histories of anxiety, and you look at their family histories, you will see that there is a family history generally of anxiety disorders in those families. So that plays a very important role. Your occupation, the kind of work that you do, if you are in a state of constant stress, that can be a precursor to an anxiety disorder. The expectations that people have from you can be a cause of stress and hence lead to anxiety symptoms.
Okay. Will you please explain the difference to us between being anxious about a particular event or issue versus being diagnosed with an anxiety-related condition?
So generally when we talk about anxiety disorders that have to be treated, we are looking at individuals who are having social and occupational impairment because of their symptoms. So if you have somebody who occasionally has anxiety, it does not impair with their day-to-day activities, does not impair them social functioning, does not impair their occupational functioning, then I would not consider that an anxiety disorder. It has to cause significant amount of impairment in an individual's life for it to be classified as an anxiety disorder. Now, when you look at anxiety disorders, there are multitude of anxiety disorders. Generalized anxiety disorder, for example, are individuals who will feel nervous and anxious all the time. They will have difficulty relaxing. They will have difficulties with sleep. They will notice symptoms of racing thoughts. Their attention and concentration might be affected. So these are individuals who are in a constant state of stress and are unable to relax, even though the situation around them might not be anxiety provoking, but they are unable to settle down in a situation that is relaxing for everybody else.
You mentioned a few of the symptoms that one might notice if they are suffering from anxiety. In addition to the symptoms you've discussed, are there any other things that people can watch for in their daily lives?
I think the biggest thing to remember with anxiety disorder is that a lot of individuals, especially if they are doing well and are doing well in society, tend to self-medicate their anxiety symptoms by using drugs and alcohol. Alcohol, in fact, is quite often used by people who have anxiety disorders to calm their anxiety. It is not uncommon for people, for example, who have social anxiety disorder to have a couple of drinks before they go out to a social event so that they can be more social. And that can lead to more problems later on with addiction and abuse issues. So that is something that people with anxiety disorders need to be very, very cognizant of and make sure they're getting proper treatment and not relying on drugs and alcohol to self-medicate themselves. Sleep issues is another big issue that you will see in individuals with anxiety disorder. The most common thing that I tend to see patients talk about with anxiety disorders is that they will replay their whole day in their head as they're trying to go to bed at night, and they'll have difficulty shutting their brain off and going to bed. So it's not uncommon for patients to come in and tell me, I've been having difficulty sleeping, and when I ask them what is going on, it is they're replaying it. They're worried about what is going to happen tomorrow. They're looking at what are the mistakes they made today. So they're replaying the whole day over and over again, and hence struggle with these racing thoughts at the end of the day, which affects their ability to fall asleep.
So you mentioned at least potential alcohol and drug use, problems sleeping.
Sure.
Any other warning signs that someone who thinks they may have an anxiety disorder should watch for?
If the anxiety disorder is left untreated over a period of time, it can morph into a depressive episode. So depression and anxiety are in fact very closely interconnected. Approximately 65 to 70% of people who have depression will have comorbid anxiety. And it is not uncommon for their depressive episode to start with an anxiety episode. So it will start off as an anxiety disorder and then morph into an episode of depression. So just focusing on anxiety is not enough. Sometimes keeping an eye on your mood, any helpless, hopeless feelings, excessive feelings of guilt. These are all symptoms of depression that individuals also need to be aware of.
So if someone finds themselves in a position that they have received a diagnosis for an anxiety-related disorder, what's next for them?
I think they need to go and talk to their primary care physicians about treatment for anxiety disorders. Treatment for anxiety disorder includes pharmacotherapy, that is medications. In fact, the biggest misconception about antidepressants is that people feel that antidepressants are only used for the treatment of depression. In fact, vast majority of antidepressants work very well in treating anxiety disorders and are considered first-line treatment for anxiety disorders. So along with pharmacotherapy or trying antidepressants and talking to your primary care physician, psychotherapy has also been shown to be very, very effective for treatment of anxiety disorders.
Thank you, Dr. Singh, for sharing your insight with us and taking the time to talk with us about anxiety. And thank you to those of you who have taken the time to view our video on recognizing the signs of anxiety and understanding it and understanding the treatments that are available to you. Take care.